So here we have Laura Taylor, who is 35 years old. She's here for her prenatal visit and states that she's on her second trimester. She's currently 20 weeks pregnant and is here to establish prenatal care. And she's also been complaining of back pain and breasts have been feeling more tender than usual. She also states that started happening about 2 weeks ago. She also states that she gets worse after being active all day, and she has not found anything that relieves the pain. She does not take any medications for the pain and describes it as a sharp pain that comes and goes but does not radiate to the legs. She denies any numbness or tingling, and this is her third pregnancy. She's only currently taking prenatal vitamins. She's allergic to latex, which causes her a rash, past medical history of depression, and has a history of 2 miscarriages. She had an elective abortion at 18 years old and a DNC at 31. For family history, her father died of a heart attack and her mother has type 2 diabetes. The patient has a bachelor's degree in education. She's a third grade school teacher, lives with her husband in an apartment, hasn't had any alcohol for the past 20 weeks. Used to smoke marijuana and tobacco, but stopped once she found out she was pregnant. She does feel safe at home. She has gained some weight, but denies any fatigue, no chest pains or palpitations. She denies any unusual bruising and rashes, denies cough, wheezing, doesn't use any corrective lenses, and has no vision blurring. She denies any abdominal pain, nausea, vomiting, or diarrhea. No ear pain, no burning or frequency with urination, no history of STDs, and her last pap smear was a year ago with normal results. No sinus problems. She does, however, complain of back pain. No lumps or bumps on her breasts, and denies any syncope episodes or weakness. No history of blood transfusion, and denies any depression currently or anxiety. Current vital signs were BP 132/64, temperature 98, pulse 75, and respirations of 20. Her physical exam was within normal limits, no abnormal findings. One differential diagnosis is hypertensive urgency, which is when there's significant increase in blood pressure without any life-threatening complications, and this is usually defined as a systolic being greater than 140 or diastolic being greater than 90. Symptoms include headache, dizziness, or visual changes. Another differential diagnosis is pregnancy in the second trimester, and this is when the fetus begins growing rapidly and fingers and toes and facial features are more developed. At this moment, the risk for miscarriage is greatly reduced. Another differential diagnosis is fibroid degeneration, which is when the uterine fibroids undergo a change in the structure, which can cause pelvic pain or abdominal bloating. My final diagnosis is that this is a normal pregnancy. In the second trimester, the patient blood pressures is within normal range, and it's not within the range of hypertensive urgency, and the patient is not experiencing fibroid degeneration because she's not complaining of any abdominal pain or fevers. This patient presents with the second trimester of their pregnancy, and they are experiencing less nausea and are gaining weight. In the office, we did basic metabolic panel, which was within normal limits, and this helps provide information about hemoglobin and hematocrit, because iron deficiency anemia is common in pregnancy. We also did a complete blood count with differential, which came back within normal limits. This helps measure electrolytes and kidney functions and glucose during pregnancy. We educated the patient that she should continue taking the prenatal vitamins daily as said in the bottle and directed. She should continue with rest, hydration, and eating a well-balanced diet. We educated the patient about regular checkups and routine prenatal visits. For cultural consideration, making sure that the family is involved and that they respect anything for the patient. We also educated her about cervical cancer and the importance of well visits and where to get pregnancy help. We also refer this patient to OBGYN and to follow up with primary in 4 weeks.